Let me clarify one point, and that is a recent recommendation that many of you all may have seen on the news or heard about or read about to stop prostate cancer screening altogether came from not the American Cancer Society, but a separate organization called the U.S. Preventive Services Task Force. And this is a body that's funded by the government, although they're not a government agency per se, to look at scientific evidence related to all sorts of things. So they issued this prostate cancer guideline. They also issue guidelines about diabetes screening and treatment. They issue guidelines about mental health issues. So they look at a lot of different medical evidence. But with regard to prostate cancer, just last month, they issued a recommendation to both physicians and to the general public that prostate cancer screening using the PSA blood test no longer should be done on a routine basis across the country. Now, the American Cancer Society also issues guidelines to the public and to clinicians about cancer. We focus on cancer. We don't get into the other areas that the Preventive Services Task Force does. But we last issued our guidelines in 2010 about prostate cancer screening and the use of the PSA test. And contrary to what the Preventive Services Task Force just said, our assessment of the evidence was the evidence simply is not clear. There's a lot of evidence showing that over the last 25 years, we've seen a steady fall in the likelihood of men dying from prostate cancer. We've seen a steady rise in the number of early prostate cancers that have been found. There's suggestion that some of that is related to PSA testing, particularly the earlier diagnosis. But there also is some evidence that at least some of the changes we've seen in the likelihood of men dying is because we're doing a much better job at treating men than we were able to do 25 or 30 years ago, because we've had a lot of advances in our ability to treat prostate cancer. So the American Cancer Society looked at essentially the same body of evidence that the Preventive Services Task Force looked at, but we came to a different conclusion. And our conclusion was that PSA testing may contribute to saving lives. On the other hand, we do agree with the Preventive Services Task Force that PSA testing and then the subsequent diagnostic and treatment elements that go along with having a high PSA test often lead to harms. And because there are potential benefits, but there are very clear known harms, what the American Cancer Society says about PSA testing is men should understand that there's good and bad and make a decision about whether or not to be tested based on your own personal preferences. There are some men who say, if there's any possibility that I've got cancer or anything else anywhere in my body, I want to know about it and I want it out of there. But there are other men who say, well, wait a minute, you're saying that I can have this test and you don't know if the test is actually going to help me in the long term. You don't know that even if you find cancer that it necessarily needs to be treated. You don't know. There's too many unknowns. So I don't want to head down that pathway. So our recommendation is what we call informed decision making. Before men have this test, they should understand that there's potentially some good, there's very clearly some bad, and then based on their own personal values and preferences, they decide whether to head down that pathway or not. Now, for African American men, we do state very clearly, African American men are much more likely to be diagnosed with prostate cancer. They're much more likely to be diagnosed with the aggressive kinds of prostate cancer that can kill, and they're much more likely to die of prostate cancer. So they need to take those elements into account when they're making that decision. But it still needs to be an informed, personalized decision.
Dr. Brooks, could you just, for the benefit of the people in our audience, let's distinguish about what the PSA test does and doesn't say. The PSA test does not diagnose prostate cancer. What does it do?
Right. Well, PSA, prostate-specific antigen, is a chemical that's made in the body by the prostate gland. And as the prostate gland grows, number one, it produces more PSA. If there is a cancer present, that will cause it to produce more PSA. But a high PSA level just means that there may be something slightly abnormal about your prostate gland. In most cases, men who have a high PSA level after they go through a full evaluation, will not be found to have cancer. As a matter of fact, about 2 out of 3 men who have a high PSA, after they go through the full evaluation, which usually means a biopsy, actually taking a piece of the gland, 2 out of 3 men will be found not to have cancer. So the PSA test really just tries to help us separate whether you're likely to have cancer or not have cancer, and then you've got to have additional testing in order to find out if cancer is actually present or not.